Good morning, you all. Can everyone hear me okay?
Can.
Okay, looks like folks are still jumping on, so we'll give it just a minute or two.
I'm gonna go grab some water real quick.
Perfect.
Just let you guys know, there are some council members that are in on the attendee list.
Okay.
Yeah, so just letting you know, like most of them look like they're all on the attendee list. Good morning, Whitney.
Good morning, everyone. How are you doing, Miss Tasha?
I'm doing well, thank you.
Great. Hey, what was your weekend? It was all right.
Yeah.
You had plans for this weekend?
I'm gonna go see my father's grave, up in
Oh,
Woodland Park and see the trees. So yeah,
okay. I'm sorry to hear about your loss.
it's okay. Thank you.
Mm-hmm. No problem.
Hello, Council. Hello, Whitney.
Hello, madam. How are you?
I'm good. I'm good. Hello, Keith.
Hey,
Grand Rising. How's everybody doing?
Good, good, good.
good morning.
Good morning, you all. Okay, give me just one moment, just making sure.
Okay.
Hey Megan, you can ignore my message that I just sent. I was having a problem logging in because it had Google Meets and Zoom on the invite.
Got it. Yes, for this meeting, all of our calendar invites come from Google, but this meeting will always be on the Zoom format. Apologize for that. I know it can be a little tricky sometimes. Okay, I think we have everyone promoted now. Oh, just kidding. Couple more. Bear with me for just a moment.
You're fine, Megan.
For some reason, Antonio.
I'm here. I'm here, but I'm traveling. Sorry. Seth.
Okay, hi, Seth. Antonio, I am trying to make you a panelist, and for some reason it is not. Antonio, do you want to try to log off and log back on? And I apologize to you all. My support for this meeting is not able to join this morning. So usually Sandra joins and shares things. So I will be putting them in the chat for you all. Let me get the agenda for you.
I was in the wrong meeting. I'm glad I found us.
Oh no. Okay, give me just a second, you all. Okay, we are ready, you all. Thank you for your patience. And welcome to our BHAAC meeting on this beautiful fall morning of October 16th. I am Megan Shelton, Culture, Practice, and Accessibility Advisor for BHA and your BHAAC BHA leadership. And with that, I will pass it over to our chairs to get the meeting started.
Good morning, Council. Good morning, Colorado. Happy October 16th. Megan, can you make sure we have quorum? And Kasha, will you roll call?
Yes.
Tasha, roll call.
Sorry about that. I was having technical difficulties. Good morning, everyone. All right. So Danielle Ungotti. Dr. Rob Archuleta.
Here.
Good morning, Dr. Rob. Preston Berry. Whitney Butcher.
Present.
Raquel Garcia.
Present.
Anaya Hall. Carolyn Hall.
Anaya's here. I don't know if you can see her or not. I'm here.
Thank you. I appreciate that. Tasha Conkers present. Judge Elizabeth Leith.
I think Dr. Lee.
Lindsay Mish. Maria Martinez.
Here.
Good morning, Maria. Maria Nagel.
Dr. Nagel had emergency, could not be present.
Thank you. Keith Parker.
Present.
Good morning, Keith.
Good morning.
Carrie Parchinsky.
Present.
Antonio Pito.
Present.
Michael Ruttenberg.
I saw him, Tasha.
Okay.
Sorry, I'm here. I didn't hit unmute. That's all.
It's okay. Thank you. Jennifer Silva. And she's here too. And then,
Can you hear me?
yes, thank you, Jennifer. And Catherine Washington.
Good morning, present.
Good morning.
Good morning, Catherine.
And I turn it back over to you, Raquel.
And
Thank you
Raquel,
so
it is 9:12 and quorum is reached.
Sweet. Wonderful. Thank you so much, Megan. Moving forward, will you review Megan review the BHAAC meeting packet, or we're just asking folks to review that and putting that in the link in the chat?
I will put it in the link and we will, yes, let's ask folks to review it. That was also sent out to you all in the pre-meeting email, so you all should have access to that, and it is on our drive.
Wonderful. Thank you so much. Agenda overview. We will review the September meeting minutes and review and vote. So if you have hopefully you've had time to review the meetings from the minutes from September's meeting. We'll go over council business, requesting an update on the BHA leadership turnover. There's been change. BHAAC community building update. Upcoming agenda items over the next 90 days. We'll talk about in November, the November budget change and workforce. In December, we're going to review the 2026 calendar planning. And in January is the safety net. And so what we like about this is that you're going to see ahead of time, and so will community, about what the discussions will be about at those meetings, right? So, obviously safety net, come to January's meeting if you want to know how to input or give input and be present for those conversations. So something we're kind of changing, giving some forecasting to the community. We'll do sharing considerations for the grievance team. So we want to hear some feedback from them. We'll be hearing that. We'll take a little break. We might have to skip break today for time. But I'll try to keep us on schedule. And then we'll have the Child, Youth, and Family Services update and Q&A. So we want to know what have been the challenges, overall update. We'll go through those questions and then public comment at the end. So again, Megan has put the BHAAC meeting packet, if you want to review it, into the chat, hosts and panelists. All right, let's go. We're going to call a vote. First, I want to know if there are any corrections to the minutes as distributed from last month. Seeing as there are no changes or there are no corrections made, I'm going to call for a motion.
Tasha Conquer, I motion.
All right. Second?
I'll second the minutes,
Thank
the
you,
motion.
Carol. Any comments? All right. All those in favor? Any opposition to the minutes? Thank you. Seeing as there no opposition, the minutes are approved unanimously and will be Maria. Thank you. Seeing as there is no opposition to the minutes, the meetings are approved as is. All right, so now we're going to move on to council business. Requesting an update on the BHA leadership turnover. Megan, I think this is you.
Yes. So for update, we are currently in the process of interviews for deputy commissioner. And hopefully, I know those will be wrapping up this week or next week. And then I believe they are also in the process of getting interviews set up for the division director of our technology and data team. And then one more exciting hiring update to share with you all is the agricultural position that will oversee rural engagement and agricultural behavioral health, agricultural farming, and ranching communities throughout Colorado. That position, they have put an offer out, and I believe the person has accepted it, but I don't think I can announce it quite yet. I want to confirm that. And they will be starting at the beginning of November. So that is really exciting that person will be able to join the Agricultural Behavioral Health Summit in Monte Vista on November 13th and 14th.
Thank you so much, Megan.
This is Jennifer. Just quick question. Megan, who was in the previous deputy commissioner position?
That was, so the previous deputy commissioner position was less. Now I'm skipping on his last name. I'll get it for you and I'll put it in the chat.
Thank you.
Anybody got any feedback or any questions for Megan on the BHA leadership turnover? Tasha, do you? Go ahead.
Can we just clarify what deputy commissioner position we are speaking about? Because I know that there was deputy commissioner of, yeah. Thank you, Catherine.
Thank you, Catherine.
Yeah, if we can get clarification on what deputy commissioner position you're speaking of.
Absolutely. And we have been doing a little bit of restructuring to make sure Commissioner has been very committed to making sure that BHA has the right people in the right places and that our positions are designed in a way to best meet the people of Colorado. And so let me see if I can get the exact title for this one. This is the Deputy Commissioner of Administration. And so then our other Deputy Commissioner is Kelly Cossey. And I believe that those will be our two Deputy Commissioners. And Kelly is overseeing children, youth, and families, as well as adult continuum at this time. So hopefully that answers your question.
Thanks. Yep. Tasha's satisfied. Appreciate it.
Thank you.
So we sent out an email for the community building. I sent an email out that we will be doing a coffee talk online. It's the best way to get us all connected to start. We'll kind of do some in-person stuff when we get through the winter season. We just figured it's kind of easier with holidays coming up. So we'll be doing a BHAAC coffee talk online Thursday, November 20th. From 5 until 6:15. We'll start with a few light group activities and then we'll just get connected personally. Being very wise to the fact that we can do no person or no BHAAC business can happen during that meeting. In order to stay within statute, we will just be getting to know each other a little bit personally, what we do in the world, where we're at, and get to know each other a little bit better. So you'll be seeing some of these coming up at least quarterly moving forward. And we'll do as many in person, but with the statewide council, it gets to be a little bit challenging. But maybe we can kind of time some of those out. We've talked about timing them out to some of the traveling of the BHA, right? And we've been able to see some expansion on us seeing each other in person when some of us come out to those community engagement meetings with the BHA and show up for those, can maybe do some alignment with those so that we can see each other in community. That's been a really big blessing this last year. And like I said, upcoming agenda items over the next 90 days, right? We are going to be reviewing in November. We'll be talking about the budget changes that came in from the governor's budget. And we'll be talking about workforce. We are really important. Your executive committee is really stressing the importance of hearing about behavioral health workforce and how the BHA plans to support us all moving forward. It's a huge conversation. So in November, be prepared. And council, if you've got things in the meantime that you want brought up, please send them to executive. Again, right, we are a committee that puts the agenda together, but really who is informing that information and what you want to hear about workforce, we need you. So Jennifer, if you've got anything, Keith, you've got anything, Carrie, you've got anything, Michael, all of you, send that stuff to us so that we make sure that stuff gets addressed to workforce. Because we've got a lot of questions. I've been getting a lot, and I know we all are, it's been a little unsteady lately, so. In December, we'll talk about the calendar planning for 2026 and the things that we want to see. Who do you want to hear from? Who needs to come and talk to us? What do you want to hear in 2026? That's something we also want to hear. And we're going to be talking about that in December so that we can set ourselves up for success next year, right? And then in January, we're going to be talking about safety net. We're going to have the BHA talking to us. And one thing that we have done as a council, both Tasha and I as chair and co-chair, is asking for feedback loops. So something we're really important with is that if we get presented and we give some suggestions, we want to know either why those suggestions were taken in, why they weren't taken in, what is happening, so that we don't feel like we're just talking to nothingness, right? We want to hear, how you incorporated our decisions or not, right? We're an advisory council. They can also say no, right? We are to advise, but we want to know more. We want to know more why. So that's something that we're actually working really strongly with Megan and aligning with the BHA to make sure we get those feedback loops. All right, at 22, I got us back on schedule with 2 minutes to spare there, Megan. Look at me, got it made up. So let's move forward in sharing considerations for a grievance team.
Raquel, really quickly, I'm taking meeting minutes as you're talking. Can you tell me the time for the community building? I have it as Thursday, November 20th, but I missed the time.
From 6:15, from 5 to 6:15. We're gonna do about an hour and 15 minutes of connection.
And that's 100% virtual.
100% virtual.
Okay. Okay, thank you. Sorry to interrupt.
No, great. Thank you for that in the chat, Michael. I said that. I hear that. I'd like to hear about licensing of mental health, only BH practices, and how the BHA is supporting those providers' practices. Megan will grab that out of the chat for us, Michael. Thank you.
I will grab that out of the chat. And that's probably a good topic to loop in with our safety net discussion too.
Absolutely.
Okay. And then I'm excited to welcome Rochelle from our grievance team. Let me make sure that you are promoted as a panelist. Rochelle, are you still on here? I know I saw you earlier.
Hi, I am here. Thanks, Megan.
Welcome, Rochelle. Thank you so much for joining us today.
Thank you for the invitation.
And then I'm going to, in our meeting minutes, Rochelle, I'll put this back in the chat for you to see too. Our September meeting minutes. You all should have it, but I'm going to link it here one more time just in case anyone missed it. Okay. So Rochelle, council wanted to invite you here today just to hear their considerations. As you know, they complete an annual report with recommendations. And one of the topics that they make recommendations on is the grievance system. And so there are, if you scroll down to page 4, there's questions that they have on the grievance system, and then they wanted to review any other feedback with you all. And I will turn it over to Raquel and Tasha to run that discussion with you. But today is really to be able to more of a listening session. As I had shared with you, they're not asking for a presentation from you, but they want to be able to give you their feedback and ask questions as they come up too.
Thanks, Megan.
Raquel, would it be helpful for me to pull up our report?
Yep.
And then you can share those recommendations. And Rochelle, I also, as I mentioned, the council is not expecting you to have answers or immediate response to these things. This is more today, just opportunity for you to hear them, and then we'll invite you back at a later time to give more feedback too.
Thank you. That sounds great. I look forward to the feedback.
So I think some of the discussion comes around I think it was no changes. Megan, I do need those questions if I can.
Yes. So the questions that we talked about are in the meeting minutes in the chat, and then I'm just going to pull up. Do you think is it more helpful, Raquel, to just go through the recommendations in the annual report?
That's where I was going to go. I mean, I could pull them out. I'm pulling them in the minutes too.
Okay. I am putting the report in the chat now.
Thank you.
Antonio, you are not on mute, just so you know.
Tasha, can you pull it up? For some reason, mine is like now my Google wants to tell me I am like got to change storage or some weird thing.
Pull up the front,
The
the
annual
meeting.
report, because I wanted to
Okay.
pull the questions that we had straight out of the report. I don't want to ad lib. There are a lot of the things that we had talked about with Dr. Rob. Yeah, for some reason now my Google Drive wants me to get more storage. I apologize. I can't pull it. I can like open it, but I cannot like download the report.
Okay, I'm looking too. Do you
Raquel,
want me to read?
Here we go. I got it. I actually just downloaded it. Hold on.
Raquel, the grievance system is on page 8.
Yeah. So there were some council recommendations about the grievance system, and they are as follows. Let me actually, if for those of you who cannot, I'm actually going to put the report. Oh, it's not going to let me. Okay. Council recommendations about the statewide grievance system are as follows. We had some questions about simplifying the processes needed to navigate finding the complaint form. This includes providing ADA accessible accommodations for the statewide grievance system to ensure that the system is accessible and comprehensible for all persons of Colorado. And we recommended that the BHA have multiple methods for a grievance submission through online forms, phone, mail, and in-person submissions. Additionally, we recommend that the BHA develop a supportive hotline to facilitate any ADA accommodations requested and to produce materials that are available in large print, multiple languages, and are accessible to screen readers. So that was one of them. I'm just going to go through them quickly. And then if Megan, does Rochelle have access to the report so that she can actually see what's written?
Yes, I put it in the chat. Rochelle, are you able to see it?
I have the meeting minutes. Can you tell me which one in the chat is the report? I'm sorry.
It should be the last link that I put in there.
Okay. Finalized to 2025 BHAAC annual report?
Yes.
Perfect. Thank you. And then
Go to page
7. Got it.
Yeah, 7, 8. Yeah.
Thank you so much.
You're welcome. The BHA to provide quarterly updates at council meetings that show how questions and recommendations are being addressed in regards to the grievance system. So that was kind of like our feedback loop. A feedback tractor with status updates, pending, in progress, and complete, so we know where in the process the grievances are. Acknowledgement within 5 business days and an update within 10 to 15 so that we know like what's happening, that once people are putting in a grievance that they know they have the expectation of when they'll be followed up with. The BHA provides the council with step-by-step walkthroughs of the grievance process to include scenario-based examples to illustrate how different complaints are resolved and concluded with Q&A. Train peer support navigators to guide individuals through filing and following up on grievances with individual suggestions. Provide a plain language handbook. Publish quarterly by the number snapshots on the BHA website. And then the council strongly recommends changing the language from grievance and complaint to feedback to also accommodate positive feedback in addition to negative. This provides a more collaborative approach for providers. That was one of our strongest recommendations, and we understand that grievance may be part of what has to be written, so that we actually had thought even after this was, can it be grievance and feedback so that it is also not so punitive, especially when we're dealing with a workforce who's feeling quite burned out and stressed out at the moment. To add it to just be punitive does not feel supportive of providers, is our feedback. And so those were some of the suggestions that we have for the grievance. system. Did I miss anything? Tasha, go ahead.
I just wanted to make sure that that the public has access to everything. So there's complete governmental transparency and accountability according to the Colorado Open Records Act. I know that there's some stuff on the website that you can't access, like the data for the grievance. All it does is show you a form. When you go in there under the Performance Hub for the grievance to look at the data on that, we are not able to access that.
And someone's in the chat asking for a copy of the agenda to attendees.
Yes, give me one moment, Lily.
Thanks, Megan. All right, back to grievance. Thanks, Megan. Just making sure you could see that in the chat. Council, does anyone else have anything else, recommendations or anything that are outside of what I've stated that also need to be addressed before I open up the floor to Rochelle so she can respond? Or thanks, Jennifer. You good, Rob?
I guess the only other thing I would ask is, does in the grievance policy, does it also connect to the RAE? Is that explained? Does it connect to the BHA itself? You know, so maybe just seeing, is this just a provider complaint box? And then if not, where do they complain about the RAE or to the BHA? So, I mean, that would be my two biggest questions that you and everything else you said.
No, I think you're right. I think that was missed. It was about not just a grievance and feedback for the provider, but grievance and feedback on the RAE for maybe organizations or individuals that are struggling with the entities managing. Also the same thing for the BOSO. I think it's going to be needed, and the BHA, if you're talking about, right, Rob, all of those entities where we can also get back to system grievance and system feedback, not just an individual provider. So it doesn't feel like it's targeted to the individuals doing the work. Yeah, Rochelle, thanks for that acknowledgement. That was great. Thanks for that, Rob. Did you catch that, Megan? I know you're doing note taking.
Yes.
Okay. Tasha, you have anything else, or is that the same hand?
So my question is, I'm just curious how us as the advisory council members, as well as the public, can track the data with the state so we can make sure that there is accountability, transparency and accountability all the way around. And you can't do that. So that to me is a little fishy. So, and to the public. So just keeping that. Thank you.
Thanks, Tasha. Rochelle, you want me to open up the floor? Do you got any?
Sure, thank you. Tasha, I wanted to respond. We do have an annual report that we presented, and that should be coming to our website soon. We wrap that annual report up in September, and it has all of our data about the number of complaints that we've received, how many were resolved, how many were outstanding at the time of closure, which is July 1. We do this on a fiscal year calendar. And so I think that is just going through the different systems internally, if you will, to be published on our website. And I will definitely let you all know when that is available. And thank you for letting me know that the Performance Hub isn't giving any data. Some of our data points have continued to change as legislative language and rule changes, and we're trying to keep up with that on our documentation so that we can track those components. As we updated the grievance website this year and the landing page, it does have all the ways that you can submit a grievance by mail, phone, email, or submitting the grievance form itself. We have moved from a Google platform to a Qualtrics platform, which allows people to truly be anonymous. In the past, you had to have your Google account to be able to access that form, and so that was limiting. And I appreciate the feedback on both the form of how to submit a complaint and offer feedback to include the systems of RAISE, BOSSOS, and BHA, because I can tell you that I created that document and that is missing. So I look forward to updating that. And that has been approved, but that doesn't mean I can't still try to update that and send it through again for approval so that that is accessible to all of you and the community via website, but also our providers. We look forward to sharing that with our providers and community engagement specialists. And I did have questions on the agenda about what is the grievance policy for BOSSOS and what is the grievance policy for the BHA. But it sounds like you are meaning, how do we file a grievance on the BOSSOS, or how do we file a grievance on the BHA? Is that correct? Okay.
That's what we're doing for.
Yeah.
Okay, so I just wanted to make sure I'm interpreting that the right way. Let's see. And yes, the system does empower complainants to offer suggestion on the complaint form. When submitting it online, it does ask, how would you like this issue to be rectified? So it does ask the consumer what needs to happen to address their problem to their satisfaction. And yeah, I look forward to hearing more about the feeling of punitive versus collaborative when addressing complaints. And it sounds like if providers can also give us feedback, as you mentioned with the RAISE and the BOSSOS, a systematic feedback. We can take all complaints on that website, but I don't know that that's clear that we will accept complaints on RAISE, BOSSOS, and BHA, and that we want to also offer you the appropriate place that we might be sending that information for the RAI and BOSSOS to communicate that information. We will accept it and forward it on to them, but I understand you may want a more direct line, and so that's something we can improve on as well.
Well, and I think we'd want to know, like, if we're talking about the BHA, struggling with the BHA, what's the process? Who's part of that conversation, and where is that going? So if I share something that I'm struggling with array, as a provider, I want to know, like, where is that going? Who's involved in the resolution of this? To be honest, y'all are systems. And so being very candid, right? Like complaining about a system's already challenged. So like, what is that? Is that like a committee of people that get together, and who's on that committee that talks about this? Like what is the process when it's a system complaint against the system? The individual, y'all have made that very clear, for us as individual providers. But when it comes to systems, what does that process look like so that we understand the pathway for it? I think would be important also.
Sure. So knowing more about the pathway of those complaints for the system.
Yeah. Who's involved? I feel like it needs to be some peers that aren't part of the system so it doesn't get stuck in an echo chamber of the system. System likes to validate itself. Systems do. They just do.
And I had a similar question to Raquel, is what happens when someone complains against the BOSSO in the RAI? Where does it go? How is it resolved? And if someone complains about the BHA, where does that go and how is that resolved? So same question.
Sure. We can provide clarity for that.
Thank you. 41, we're on time. Tasha and then Dr. Ra.
So on the Performance Hub website with the Performance Hub, there is it's under data managed service organizations. You can submit. It has a hyperlink to Rocky and Signal, which are the BOSSOS, and then the resource links. When you go to access that, to look at that, it comes up as you need to have permission, and that's public facing. So, and then I'm also wondering how are we tracking that data? Because once again, when you go to hit the thing, you have to ask for permission, and that's public facing. That's not the council's intra, I guess in our drives or whatever, that's straight public facing. So that's not being transparent to the people of Colorado when it comes to the grievances and when it comes to the care that they're getting.
So Tasha, are you saying that people need permission to make a complaint?
Well, it explains, it has all the hyperlinks for the complaint forms on the Google, on the performance. But when you go to access to see where that data is being tracked, you can't. It comes up that says you need access, and then you have to submit to get access.
Okay.
And so it's a little confusing to me when I go to see how the data is being tracked and how complaints and grievances or feedback or however, whatever it is, how that's being tracked. That's not being transparent.
So it's permission to track, but you don't need permission to complain.
No, you don't need permission to complain. No, it walks you all the way through on the Performance Hub and the complaint. It walks you all the way through.
Yeah, I put a link in the chat, Jennifer. If you look in the chat there, I actually put a link for the form. So you can see how it's changed from a Google form to the Qualtrics of form. And then you can see the hyperlinks, right, for the complaints process to the BHA and the standards and all that like content there. Just so you guys.
Yeah, it explains all that. It walks you through that. But when you go to see how the complaints the data is being tracked, we're not able to track that. And the last data that we have is from 2024. So that's outdated.
Thank you, Tasha.
Thank you.
Absolutely. Rob, and we're at 44. Yeah, thanks.
Yeah, so can you hear me?
Got you.
Yeah, so number one, like I just did not like the way it was worded. It seemed like the BHA was soliciting complaints. It's already easy enough to complain. It was really inviting and encouraging, like, hey, we know this is hard. Please do it anyway. Because we just work with the demographic that will not always be satisfied. And for me, I mean, it just was odd to have a flyer going out like for complaints, like we're going to do a promotional push for the grievance process. And like I said, it's easy. You could look up, on Dora, you could file a complaint faster than you could find a license. And we do it as an employer all the time. The other thing is that the reason I say that is because now said that we have to have the BOSSOs and BHA on there is because now the BHA is going out in the communities. They're talking to community members. So are the BOSSOs. They're going out. We're having town halls. So they're getting to know people. They're hearing promises or they're hearing suggestions or things that are said that is going to happen. And we've also had times where, just for example, like we have the IC team at the BHA over promising a family member who then looks at the provider because the provider can't make magic happen or whatever. And there's never ever a place for the clients that are the families we're working with to say, hey, the BHA told me this was going to happen. The BHA told me they qualified for this. The BHA told me, and I'm like, well, sometimes there's some over promising. There's also sometimes the doctors will reject something. And, so I just think there needs to be a place so that we can direct, hey, that's not us as an agency or as a provider. That was the BHA that said this. This was what we thought as a provider. This is what the doctor thought as a provider. And then, just also that's for the BHA and with the BOSSOs in general too, now that the BOSSOs will be having care coordinators and other people that they're sending out. And, it's not just looking like we're giving referrals for dead ends if they're not contacted. Who do they contact next if they're trying to reach a care coordinator or somebody in the BOSSO system? So that was my biggest things that I wanted to address.
Thank you, Dr. Archuleta.
Anything else? Thank you, Doctor. All right, anyone else? Rochelle, you got anything else before we let you go? And then I know our hope, what we wanted to do is have these challenging conversations because they need to be had. That's what we're here for also. And having this conversation, Rochelle gets to go back, we get to work on some things. We're gonna have some conversations, make sure that what we're asking and come back. And we want to ask, right? Why was our suggestions not? What did it go against? What we want to ask more questions, and we'll reflect on everything that we asked here in the next meeting, just to keep us on point. Because again, right, like I think the first couple of years we were great at being presented at, not getting follow through, follow back, and answering those questions, So thank you so much. I appreciate your time, Rochelle.
Thank you all. I appreciate you all as well and the feedback given. Have a great day.
There's another good comment in the chat.
Yep.
Thank you. I will screenshot that so that we have it.
Yep. Yeah, I'm glad it's not just the provider. We have a system that we're working with or for against or side by side trying. Anyway, Rob, I know that for us providers, really looking at our workforce right now, making sure that we're not pushing our workforce out. Thank you all. All right. 48. Megan, what do you want to do with time?
We are at 48. I think you could still go ahead and do a 5-minute break.
Okay. All right, y'all, 5-minute break. See you back in 5. Welcome back, everyone. I love the chat. I think that's why we talked about a navigator or peer, Carrie, right? Someone that can help facilitate that misunderstanding and help so they're not just like winging on their own. That was one part of our recommendations in the in our yearly report. I look forward to hearing when they come back to hear what progress they've made.
How's it going up there, Raquel? You guys busy?
We are busy and navigating. I think this is why we have to have a workforce question and got to have some conversations on payments and HICPUPs and the raise because. So I'm really proud of ourselves for speaking up about that because right now that's the biggest challenge we're having as providers is navigating all of that.
Well, and I know there's
trying to pay our people and taking care of everyone. It's a lot.
Megan, will you be with the commissioner at that meeting tomorrow? I could have swore I saw the commissioner was going to be there for the education.
Megan, you're on mute.
No, Robert, if you can give me more details, I can confirm commissioner attending that meeting, but I'm not attending that meeting.
Okay.
What is the name of it?
So I'm pulling it up right now to make sure I don't get it wrong.
Yeah, like tell me, excuse me. Megan's going to pull up a meeting. We're going to move into a child, youth, and family. I got you, Tasha. Hold on 1 second. Child, youth, and family update and a Q&A coming up. Tasha, do you got something, or do you want to hold off until they find this meeting?
No, I just have a quick question right quick about our meetings being posted. Meetings have not been posted to the public on our YouTube channel and stuff like that.
That's in process,
June.
Tasha.
Okay.
Yes.
Okay. So that's been since June. So I'm just wanting to follow up on that. Thank you.
And then we have Mary Kay Meinzer with us. She's our Division Director for Children, Youth, and Families. Welcome, Mary Kay.
Thank you. Hi, everybody.
Hi, Mary Kay. Welcome.
Thank you. I have put together a little bit of a PowerPoint. I got the questions from BHAAC and have tried to address the questions in the slideshow. I also created like a little bit of a matrix that I am not tech savvy enough to know how to turn it into a PDF and share it with you all very quickly. So I will work with Judith and Megan to make sure that you have it and also the PowerPoint presentation. And I apologize that I didn't have it linked into the agenda. It has been a fast and furious several of months. So I wanted first to just introduce myself to everybody. I am new-ish to BHA. I am the Children, Youth, and Family Division Director. I started in June of 2026. I am an LPC, an LAC, and an ACS, and I come from a couple of different kind of treatment backgrounds. First, at Children's Hospital of Colorado, I was in the outpatient program there in the Pediatric Mental Health Institute for 4 years and specialized in gender affirming care for transgender and gender diverse youth, and then also anxiety. So I was part of the Colorado OCD and anxiety program there. And then before that, I was at a nurse-managed federally qualified health center. I was the behavioral health director and helped stand up behavioral health services for children, youth, adults. It was basically the whole age range at a place called Sheridan Health Services. And just love making sure to have Coloradans have access to behavioral health care and good behavioral health care. So yeah, that's my background. I'm very excited to be here today and hopefully address some of the questions that you all sent. So I'm just going to share my slides. And again, I'm not tech savvy enough to know how to uh, share them and not show my notes. So hopefully you all can, that'll be okay with you all. And then Megan, if you could just let me know if folks have questions in the chat while we're going, that would be super helpful. Can you all see my slides?
And then Mary Kay, I will create this into a PDF so that it can be shared and linked to the meeting minutes for the council as well.
Oh, awesome. Thank you so much. Okay, so what I understand is that today I'm going to give you an update on the Children and Youth Behavioral Health Implementation Plan that has been up and going. We just finalized or closed out our second year, and we've moved into our third year. Moving into the third year started on July 1st of this year. So for some background, the Children and Youth Behavioral Health Implementation Plan aims to transform behavioral health services for children and youth across the state from a fragmented program to a unified, accessible, equitable system. It's kind of got a dual prong purpose. First, it's to be forward thinking kind of with long-term strategies. And then second, it really at the beginning was meant to be very actionable and have very concrete steps. And then there's a link here to the actual plan. And it was born out of the Behavioral Health Task Force, which was the task force that created BHA. There were 6 priorities that were identified for the Children and Youth Behavioral Health Plan. The first was to create governance and improve statewide coordination between state agencies. The second, to create core behavioral health care continuum for children, youth, and families. Third, to sustain and expand promotion and prevention efforts for the state. Fourth is to create an implementation plan for intensive in-home and community-based services. Fifth, to support the formation of ACC Phase 3, the Accountable Care Collaborative. And then the last is to create the BHAAC systems. So what I understood about maybe what would be most helpful, I'm going to skip 5 and 6. I'm going to skip year 1 successes because I believe that you all probably know what all of those were. I'm assuming that folks have already gone over that because we're into the second year, but I just saw Tasha shaking head around and maybe no. Okay. I can go over year 1 successes really quickly. It's a hidden slide, but I can just do it really quickly. And so year 1 was really focused on those first, let me go back here. So year 1 was really focused on some of the creating the core behavioral health services for youth with high acuity needs and also creating an implementation plan for intensive home and community-based services. So 2 years ago, really the focus was on establishing the structure and the base in order for children and youth with high acuity needs and intensive home-based and community services to have a foundation. And so the successes that happened in year 1 are listed here across the state. We increased our bed capacity from 427 beds for youth to 508. There was an increase in specialized foster care bed capacity from 124 to 226. We started implementing as a state something called the ESA, or the Enhanced Standardized Assessment, and that was used for the programs that BHA oversaw. I will talk a little bit more about that for year 2. And then there was a lot of activity to launch BASO and Colorado lifts. And again, I'm going to assume that most of you know about the BASO and Colorado lifts because it's so highly connected to the work that our advisory councils have done. I apologize. Like I said, my assumption was that most folks would know the background about year 1, and I was really focused more on talking about what happened in the last year, year 2, which is the state fiscal year 2024-2025. And so these are the successes that we had in 2024 and 2025. We saw from all the base building work that happened in year 1, we saw a 61% reduction in youth on the wait list for out-of-home placements. We've increased specialized foster care placements from 226 to 271. There's 3 new QRTP providers. We've got 1 new crisis stabilization unit. For prevention type of work, we partnered with CDE to publish the DC 0 to 5 publication, which is a really important publication for working with children 0 to 5 years old and having actually a different set of diagnosis codes. Knowing that DSM-5 diagnosis codes maybe are not the best for children in that age range. We also worked with CDHS to launch a Colorado Provider Training Academy, and in the last year, 51 staff have been trained, and we're working on setting up trainers for the next 150 staff. And this is all around like being more culturally competent and trauma informed and working with children and youth in residential or placement settings. We also enacted a quality improvement process for all the residential and care facilities. And then some really big work has happened around the Colorado system of care. And I'm going to go into more details about kind of really what that means. So that is it's led by HICPUF, born out of the lawsuit against them for making sure to have more robust services and care and wraparound care for children and youth with high acuity needs. But there's been a lot of work around that. So at this point, we have a plan in place with HICPUF to ensure that all youth discharging from PRTFs or QRTPs will have access to the system of care. And I'll go more into that. And then we've also identified and started to launch our Colorado Workforce Capacity Center for the system of care with Colorado State University. And we have launched the statewide use of the CANS and the ESA. I'll go more into what those 2 things are as well. And then finally, we have CHIRP waiver services that have been expanded to support additional 22 children. And we know that 85% of youth that were involved with our crisis response teams were actually able to be supported enough where they didn't need a higher level of care in 2024, 2025. So I have linked the URL to HICPUF's implementation plan for the system of care. Can I just get a show of hands? And I can't see you all, but maybe Megan, you can count like how many people are aware of like what the system of care is and what the purpose of it is. If you can just like raise your hand so Megan could let me know.
Not enough hands are raised. So you can, I know fewer people do, I know, but I think there's not enough hands raised. Go ahead.
That's good to know. So this is why I really wanted to like spend some time on it, because it's a very essential set of services for children and youth with high acuity needs. And it's really been where a lot of the focus has happened for the behavioral health implementation plan. And the reason why it's so important is if you think about like identities and people's identities and the reality that there's positionality, right? So that each of us has a certain set of identities, and the way that those overlay are the ways that we engage with services, and the ways that services may or may not meet our needs. Oftentimes high acuity youth have several different identities or co-occurring diagnoses, which make it harder to serve them. And so we know with working with with a social justice framework, if you make sure to create services that work with the most marginalized, then we know that those can be expanded to other folks who may have fewer, less marginalization to work against, or a fewer set of co-occurring diagnoses to address. And so it's very similar with the system of care. This is an idea that is proven through research in a variety of other states that have been doing system of care work for decades, right? That if we focus on creating a system that can support youth with the highest acuity needs and then kind of expand out from there, we're better able to meet the needs of all children, youth, and families. And so the push has been in the last couple of years to really stand up these system of care services. Again, it's led by HCPF, but BHA has needed to walk in alignment with them in order to make sure that all children and youth across Colorado can have access to these services and these supports. And so the enhanced standardized assessment is a way for that, in completion with the CANS, which is the children and the adolescents needs. I can't remember the S right now. I'll find it. But those two things are what allow, or what they're used as the assessment to then make sure that the right level of care is provided to a young person. And so that's the way that they enter the system of care services. And once they are in, they get something called Enhanced High Fidelity WRAP, which is a set of care coordination and supports where their kind of their support system will either go into the home or go into the community to make sure that the children, youth, and their caregivers are supported. The other thing that happens is that they get these intensive in-home treatment services. And right now, through the system of care, that's enhanced MST or enhanced FFT. So MST is multi-systemic family therapy and FFT is functional family therapy. And I'm going to stop because I know I've been talking a lot. I'm just wondering if there's questions about kind of this approach or what I've shared so far.
I do have Councilwoman Jennifer, you're up.
Just a couple clarifying questions, Mary. How is the current budget affecting the system of care right now going forward? I think it's a great concept, but just concerned about how funding will affect that service.
Yeah, that's a great question. And I do have information about funds after this, but in essence, right now we know that we're going to need more, right? And that at this point, as it relates to amount of money, the HCPF has about 10 times what BHA has for system of care, and they have about twice as many staff to set up system of care. And so right now we have about, I have it in the slides, I can go to it. Our overall budget for BHA for children, youth, and families is $16 million. And of that $16 million for system of care, it's about 8%, 9% of our budget, or $1.4 million. HCPF, again, has about 10 times more, not quite, but about 10 times more than we do for it. Hopefully that answers your question.
Yeah. And one question back on year one, when you talked about the year one kind of recap, there was a number that was, let's see, I think it was the $200 million investment in the BHAAC and Colorado lifts. Mm-hmm. Now, and I'm not sure if you know this, but out of that 200 million, how much of that was invested in client services, or was that more administrative costs to stand up the BHAAC and lifts?
That is a great question. I don't know any of that, but I'm sure we could work with the BHAAC division, or actually our Colorado Lifts division, or commissioner and our finance team to get a sense of the breakdown around those funds.
Okay, thank you.
Yeah.
That's a good question, Jennifer. We have one more question, Tasha, or do you want to wait till the end?
I was just going to say there's a list of questions that we asked that we were needing to get answers to in September's meeting, and I put those in the chat.
Yes, and I have all of those answered. I created a crosswalk between the ones that were submitted to me and where I'm hoping to address them in the slides. And again, I'm sorry I wasn't able to get that to you all so that you could get a sense of like where I'm going with it, but I will get that to Megan and make sure that you have it.
There's another question in the chat. Michael brings up, he says, what about children with high needs that are not on Medicaid but commercial insurance?
That's a great question. So yes, that is BHA's job for us to support those young people. The way that we've worked it right now is that if their insurance covers their in-home therapy, like the MST or FFT, then BHA is covering through our different set of funds, the enhanced high fidelity wrap, to ensure that they have that care coordination while they're getting that in-home treatment. If in-home treatment isn't covered by their private insurance, then we also find a way to make sure that they're getting their treatment services covered.
Michael, do you have any follow-up?
No, thank you.
Yeah. So then the other thing I just wanted to share to give a sense of like the enormity of the work that's ahead is that right now we are in fiscal year 25-26, and this is what HCPF has published as it relates to the implementation plan to start with those core system of care services and then expand outward. And so you'll see as we move through different fiscal years, right, 2020, 26, 27, 27, 28, that you begin to see a set of more services that are outlined to roll out through these different years. Again, HCPF and BHA have agreed to roll these out in tandem to ensure that we're providing the same set of services and treatment for children, regardless of payer source. So HCPF obviously covers youth who have Medicaid. BHA is responsible for those youth who are underinsured or uninsured.
And Mary, do you know if CRT is still funded at the Ray level? I was under the impression it wasn't.
I think you're right, Jennifer. I don't think it is. I think CRT has been fully enveloped into BHA and that we're the ones who are providing it. And I also believe that we're providing it in maybe 20 counties, so not statewide. And that is one of the lifts in front of us, is that it needs to be provided. We need to find a way to provide it statewide.
Right.
Carolyn?
I have a question. So back in the day, like when children turned 18, everything was just dropped. They were out of the system, they were out of foster care, and they were out of everything else. So I'm curious as to like, what is the age now that a child, like at 18, do they lose everything, or what is the age of transition era, and what does that look like?
It's a great question. Yes, for some youth at 18, it might transition. I think that Medicaid coverage is actually extended into 21. And so for BHA, we extend up to 21. And then there's also particular consideration given to young people who have developmental disabilities or intellectual disabilities for that coverage to go longer. And for BHA, for us to, so because we're not an insurer, right? We are kind of augmenting the care that either private insurance or Medicaid is providing, that we will do the same. We will cover kind of based on the complexity of a young person.
I just want to be mindful that we're at 10:16. We have till 10:25, and I have to open up for public comment.
Questions. Okay. So one of the big things for the implementation plan was that we would set up a care continuum. And so this is a visual of the care continuum and what is connected into the care continuum. There was a question, and a lot of the questions were connected to what people were asking was community-based care. And so I wanted to make sure to bring up that community-based care is in fact kind of all of these different pillars. So I didn't know how to answer some of the questions because the answer might be different based on kind of what level of care we're talking about or kind of what topic area we're in. So promotion and prevention is community-based care, early intervention is community-based care, outpatient level treatment is community-based care, and then there is also intensive community-based care here. And so I just wanted to kind of level set with that to make to see if with those questions, anybody wanted to ask another question as it relates to kind of like what level of care. And so I'm happy to, again, answer any follow-up questions as it relates to that, because I can't really answer the question not knowing kind of what level of care is being asked about. I think I answered the question about the current state of the budget, but we can go a little bit more into that. So system of care, like I had said earlier, the way that it's accessed right now is that young people who enter PRTF or psychiatric residential treatment facilities or QRTPs, qualified residential treatment programs, they enter those through the completion of the CANS and the ESA. And so any young person who enters into either of those levels of care, they will automatically fall into system of care. They will automatically get those enhanced high fidelity RAP services and the intensive in-home or community-based services. Other children will also get those. They don't have to be stepping down from QRTP. They can have access to those services if they're in the community and someone in the community identifies through the completion of the CANS or the ESA that they would be better served in the system of care. This is the budget that was asked about. 16 million overall for children, youth, and families just for BHA, more through other agencies, our state agencies. And then the general budget overall covers operating budgets, youth mental health services like iMatter, residential treatment for youth. Cash funds are related to the state and local fiscal recovery fund, and also through our marijuana tax dollars. Most of the cash funds go towards treatment. And then the final dollars are federal dollars, and those are our substance use prevention, substance use prevention block grant, mental health block grant, and COAC. COAC are our funds through SAMHSA that help stand up the system of care. I think there was a lot of question about prevention services. I know I have, 5 more minutes? Right, Raquel?
Yes, you got 5 minutes.
Okay. So BHA does a lot of prevention services. I put in the matrix that I'm happy to have someone from my team come back or myself come back and talk about all the different prevention work that we're doing in the community. There's probably 8 different programs that we do. They fall within that early intervention, that prevention, early intervention set of that set of pillars. And you'll see here, EIPV, about 40% of our budget goes towards early intervention or prevention. That's what this green section is. System of care, that's the yellow section. That's about 9% of our budget. For the plan itself, we actually don't, for the implementation plan, we actually don't have any kind of like ongoing program management budget. We just have an administrative, about $10,000 to help with things. And then SLFRF is the state and local fiscal recovery fund. And that is what stands up most of our like outpatient or in the community programming, like our treatment programming. So, like I said, there's like 8 or 9 different programs that we have that fall within these pillars: the promotion, prevention, early intervention, outpatient level treatment. I know that there was questions about what we're doing in school. We have 4 or 5 different programs in school. We have a mental health screening program, set of programs in the schools. And then we also have the school mental health services. So we have Project Aware, and then the school-based mental health support program, which is all about helping educators identify children who would benefit from increased care. There's 3 different tiers that are used, and it's all evidence-based. It's based on the multi-tiered system of support, or the MTSS. Tier 1 is mental health promotion services. It focuses on promoting positive mental health and preventing occurrences of more intensive mental health problems. This is often district-wide supports where teachers learn about mental health literacy, social skills learning, those sorts of things. Tier 2 is early intervention, where we are focusing on preventing risk factors or early onset of problems from progressing. And then Tier 3 is training and resources, and that's really us helping educators identify how they can best support children in the school-aged area. We've also been standing up a lot of early childhood work. So for children from 0 to 5 with Colorado's Department of Early Childhood. Again, happy to come back and talk about all of that work with everybody here so that you have a better sense of what we're doing. And then year 3, these are some of the successes that we've had so far, and then some of the upcoming successes as it relates to the plan. First and foremost, one of the big lifts that we haven't addressed as BHA is that the first priority that was identified, and that is having a governance structure or what CYF has now changed to a advisory reporting structure. That is going to be very deeply seeped in lived experience. We plan in the next year to do a lot with our communities and our sister agencies to develop a new plan that is actually informed by lived experience. And we're really excited. We have a position that will be a lead family manager who will actually be somebody who does have lived experience as a caregiver of a young person with high acuity needs that will be helping us with engaging community for standing up a new plan. And then otherwise, we've also addressed one of the other priorities, or we're working on addressing one of the other priorities, which is that prevention and promotion work. We are standing up an advisory committee for prevention and promotion work with CDE and CDEC, and that'll be work that we're doing in the year ahead. In addition to all of the system of care work that I kind of went over, but is also very robust and takes a lot of time. So I know I've gone over. I'm at time right now. Don't know what would be the best way to get other questions to me.
We'll probably have to do remote because we do have to open up for public comment, but I have a couple questions. I did put one in the chat. And how do we plan to keep this continuum of care without a peer workforce? Currently, providers are being denied Medicaid codes in the western part of the state, even safety net providers, which is a big deal. And so again, right, we need to look at, and appeals are going. So like, are we wiping out a peer workforce? Are we not? I'm going to be very bold about that. We've been working really hard, and we can't be. Really big question. Like I said, Jennifer said, great ideas. Want to know if it can even happen. Do we have funding? Do we have a workforce that actually is going to continue to be able to bring this to fruition? Because you could have all the great ideas in the world, but if you remove 25% of your workforce, it won't work. And we're failing Coloradans without it. And we can do lived experience all we want, but we don't want to be tokens. We should be paid for what we bring to the table. And wiping our workforce out isn't gonna bring a bunch of happy lived experience people to the table. Me being one of them. So.
Yeah.
As a bold chairwoman, I'm going to speak boldly about that because it seems that we keep speaking about it and talking about it and educating but we're letting it go. So
yeah,
I'm getting real-time
position,
text messages
okay,
right now about it happening. So
the
I want
the position is
talk about
paid.
that financial piece.
Yeah, the position is paid for sure, and I will get comment from a copy of the comment right now and just see kind of how that overlays with children, youth, and families. I appreciate it. And then I will make sure to get the matrix to Megan so that you all can cross-reference it with the slides. And again, happy to come back.
Wonderful. We'll do some research on the questions asked and compared to what we received. Thank you so much, Mary Kay.
Yeah, thank you.
All right. At this time, we have 4 minutes, opening it up for public comment. If anyone from the public, there's a Q&A, does not have access to things that are already put in the chat. There's a question in the chat that says the public does not have access to the things that are being put in the chat. Is that intentional? Online, the last update of minutes and agendas was in June of 25. So I know that Tasha addressed that, the update. Megan had said that they're working on that. I do know that they've had a lot of change bandwidth wise, Megan, even just workload wise. So I know that it's not by not wanting to, but making sure that gets done. But Megan spoke to the fact that that'll be updated. Megan, can we expect those updates? When can we expect those updated minutes and agendas for public to be able to review? Do you know?
So the minutes and the agendas, everyone should have access to it now. There's also a comment in the chat. I think Lynn confirmed and Lily confirmed that they can see it now. I redid the settings.
Cool. So it'll click online though on the website though, not just through the chat now. Do you know what I mean?
It's not on the website yet. That's in process. So that should be within the coming weeks. Okay. That should all be on there. And then in the chat, they can all have access there.
All right, Catherine, see Catherine's hands raised. We've got 2 minutes.
Yeah, Russia has a public comment. I'm sorry, Russia Newer.
Thank you. Give
Yes.
me one moment, Russia.
Oh, I see it. I missed it in the chat. My bad. Thanks, Catherine.
Okay, Russia, you should be able to take yourself off mute. And
Hi, good morning. My name is Russia Nauer, and I'm the director for the MindSource Brain Injury Network over in CDHS. And I have public comment specifically to the agenda item about the grievance and feedback form, and to sort of piggyback on what Tasha shared around the need for there to be a public feedback loop about information and what is shared through that process. I just want to add to that the brain injury community has been asking for a lot of years for a pathway for people to be able to get information, much like you would be able to see through Google about providers. Specifically, obviously, everybody wants to try to avoid providers who are struggling with quality performance, but also people really want to be able to see which providers are trained in and have specialty in providing brain injury informed care. So I don't know if that's something that the BHA could ever stand up, but it is something that we've been hearing for a long time from our advisory council, our board, and our community of people living with brain injuries. Thanks.
thank you, Russia.
Thank you, Russia. Megan will make that note.
Noted. Thank you.
Thank you, Megan. All right, we are at our. Thank you for your time today, public and council. I appreciate the honest feedback and the honesty we bring to this space and from our lived experience, either in the world or as providers. I appreciate you. Meeting adjourned.
Thank you all.